Did you know that your healthcare premiums from 2024 to 2025 went up by an average of 13.5%? Well, I hate to say it, but they're going up again. From 2025 to 2026, federal employees are about to face another round of premium hikes, averaging between 11 and 12%. And it's not just federal workers. Just about every American will feel this one. And healthcare premiums are on a steady climb, and the news from OPM this October confirmed it loud and clear. Before the government even shut down on October 1st, ironically, over healthcare, the numbers were already baked in. The writing on the wall was that your paycheck's about to feel tighter in 2026. The truth is, your pay raise next year is only around 1%, and locality pay is frozen. So while your paycheck crawls up an inch, your healthcare cost jumps a foot. Now, this video is going to focus specifically on the Federal Employees Health Benefits, or FEHB, and the Postal Service Health Benefits, or PSHB programs for 2026. I'll save the broader discussion about nationwide healthcare premium increases for another day. But some people might say, well, at least it's not 23%. Sure, but let's be honest. When wages across the board are barely moving, an 11% increase is going to hurt a lot. It doesn't take a mathematician to tell you that. And for retirees or federal families on fixed budgets, that's not just a minor bump. That's a cut into everyday spending. So let's start with the official announcement. The Office of Personnel Management, or OPM, announced that the 2025 federal benefits open season will be held from November 10th through December 8th, 2025. During that window, eligible federal and postal employees, retirees, and annuitants can review, enroll in, or make changes to their health, dental, and vision coverage for the 2026 plan year. And according to OPM's Associate Director for Healthcare and Insurance, this is your chance to review your coverage, compare plans, and make sure you're getting the right fit for your family. Sounds simple, right? But let's be real. Anyone who has ever compared FEHB plans or any health insurance coverages knows that it can feel like reading a foreign language. And for 2026, there's a lot to unpack. The FEHB program has 47 participating carriers offering 132 plan options. The PSHB program has 17 carriers with 75 plan options. And FEDVIP, or FEDVIP, that's your dental and vision program, includes 11 dental carriers offering 21 options and 5 vision carriers offering 10 plans. And the thing is, 6 FEHB plans and 1 PSHB plan and 1 FEDVIP plan are dropping out in 2026. And if you're enrolled in one of these, you will have to switch during this open season or get automatically moved to a default plan. And if you don't act, that default might not be the one that fits your needs or budget. Now, during open season, one of the first big decisions you will face is picking which among self-only, self plus one, or self and family is the right coverage tier for you. Let me break these down in a bit more detail because it's not always as straightforward as it sounds, and choosing wisely can save you a bundle. First up is self-only coverage, and that one is pretty self-explanatory, right? It's just for you, and if you're single or if your spouse and children have their own separate coverage, and this is your go-to. It's ideal for individual employees or retirees who don't have any spouses or dependents relying on their plan, and it typically has the lowest premium because, well, it's just one person. Then you have self plus one coverage, and this is designed for you and one other eligible family member. Most commonly, this is going to be your spouse or maybe one dependent child. Now, you would expect this to be cheaper than a full family plan, and usually it is. But here's that strange quirk I mentioned earlier, and you absolutely must check the numbers. For 2026, some self plus one plans will actually cost more than the comparable self and family plans. And I know it defies logic, but the pricing models can be complex. So if you're only covering yourself and one other person, do not assume self plus one is the cheaper option. You have to run the numbers for both self plus one and self and family to find the actual best value. And finally, we have self and family coverage. And this is the most comprehensive tier and covers you, your spouse, and all of your eligible children under the age of 26. And this is the choice for most families, ensuring everyone in the household is covered under a single plan, and it generally has the highest premium as it's designed to cover multiple individuals. However, as I just warned you, don't let that assumption stop you from comparing it to self plus one if you only have one dependent. The bottom line is that each of these tiers serves a specific household configuration, and understanding which one truly fits your current family situation and your budget is paramount during open season. Now, let's get to the numbers that really matter, the dollar amounts for 2026. And OPM has announced that the average premium increases for FEHB plans is about 10% overall, but the number you really care about is the increase to your share of the premium. And that's going up by an average of 12.3% for FEHB and 11.3% for PSHB. And when you add that to last year's 13.5% hike, it means that many federal employees are seeing a roughly 25% increase in their out-of-pocket premium costs in just 2 years. And that is a massive hit. Now, let's break down what this looks like in actual dollars. The government, your employer, covers about 72% of the total premium costs, and that maximum government contribution is also going up in 2026. It'll rise to $324 biweekly for self-only coverage, $711 biweekly for self plus one, and $778 biweekly for self and family. But what about the total premium, including your share? The weighted average total premiums for 2026 will be $451 biweekly for self only, $987 biweekly for self plus one, and $1,080 biweekly for self and family. Now, remember what I said earlier about the self plus one coverage. Here's a really weird but important quirk you need to pay attention to. In some cases, the self plus one plans will still have a higher total cost than the self and family plans. And it makes no sense. I know, but it's a reality of how these plans are priced. So if you're only covering yourself and one other person, you absolutely need to double check the math to see if a family plan might be cheaper. To make this even more real, let's use Blue Cross Blue Shield as an example, since they cover about 2/3 of all federal employees. For 2026, BCBS will continue to offer its 3 nationwide plan tiers, which are Basic, FEP Blue Focus, and Standard. Before I get into all of these, please be sure to do your own research and find out what the best plan is for you. And I don't know your health situation or your family dynamic. And let's start with a basic option. And for this plan, your bi-weekly enrollee premium on average will be around $133 for self only and $356 for self and family. And the FEP Blue Focus plan remains the most affordable BCBS option. And your bi-weekly cost will be $66 on average for self only, $143 for self plus one, and $158 for self and family. But if you want the most comprehensive coverage, you will be looking at the standard option, and this is where the costs really jump. Your biweekly share will be $188 for self only, $411 for self plus one, and $458 for self and family. We're talking about a significant chunk of your paycheck just to cover your health insurance, and these are the numbers you need to be looking at very carefully during open season. So beyond just the premium hikes, there's another critical piece of the puzzle you need to understand: which plans are actually leaving the building and what new rules are coming into play for everyone's coverage. This is not just a minor tweak. For some of you, it means your current plan will simply cease to exist for 2026, and you have to make an active choice, or OPM will choose for you. So let's get into the plans that are being dropped from the FEHB program. And if your current plan is on this list, consider this your urgent call to action. So the 6 plans being dropped from the FEHB are NALC Health Benefit Plan, Health Alliance HMO Standard, AvMed Health Plan, Independent Health High, Blue Care Network of Michigan High, and Priority Health High. In the PSHB, the 2 options being dropped are the GEHA Indemnity Benefit Plan Elevate Plus and GEHA Indemnity Benefit Plan Elevate. If you're currently enrolled in any of these plans, you must elect a new plan during the open season. If you do nothing, you will be automatically enrolled in a default plan, which is the GEHA Benefit Plan High option for FEHB members, and the Blue Cross Blue Shield Service Benefit Plan, FEP Blue Focus for PSHB members. But don't let OPM make this choice for you. This default plan might not be the right fit for your family or your budget. So take the time to do your research. And across both programs, there are also some major coverage changes you need to be aware of. OPM has laid out several key updates. First, they have removed coverage for medical or surgical modification of sex traits, including gender transition procedures for all ages. On the other hand, they are now requiring coverage for FDA-approved HIV drugs with no cost sharing. And there's also an expansion of IVF coverage as HMO plans in states with IVF mandates are now required to meet those mandates. OPM is also requiring, at a minimum, coverage for the retrieval and cryopreservation of sperm and eggs, as well as storage costs for at least 1 year for individuals who face infertility from non-elective medical procedures. And access to behavioral health continues to expand, with carriers being required to broaden their networks and allow out-of-network care when wait times are excessive. And for opioid safety, carriers must continue to provide at least one opioid rescue agent at no cost. And finally, for anti-obesity care, carriers must continue to cover FDA-approved medications, including at least one GLP-1 like Ozempic and 2 oral options, plus behavioral and nutritional programs. And these are all significant changes that could affect your choices of plan. Now, this brings us to the big strategic decision you have to make, which is choosing between a low deductible and a high deductible healthcare plan. A low deductible plan typically has a higher biweekly premium, but your out-of-pocket costs for doctor visits and prescriptions are lower and more predictable. A high deductible health plan, or HDHP, has a much lower premium, which can save you a lot of money on your paycheck. But the trade-off is that you have to pay a significant amount of out-of-pocket before the insurance really kicks in. The main reason to consider an HDHP is that it makes you eligible for a health savings account, or HSA. I've made several videos about the power of the HSA, and you can check those out on my page. But in short, it is a triple tax advantage account that is one of the best retirement savings tools out there. And the choice between those two types of plans really comes down to your personal health situation. If you're healthy and don't expect a lot of medical bills, an HDHP with an HSA can be a fantastic way to save money. But if you have chronic conditions or a family that frequently needs medical care, a low deductible plan might be the safer, more cost-effective option. So we've established that your premiums have increased by over 25% in the past 2 years. The big question is why? One of the foundational reasons is that the government subsidizes about 72% of your healthcare costs. And this is a fantastic benefit, but it also means that the government is on the hook for a massive bill. There was an attempt in the One Big Beautiful Bill back in June of 2025 to remove or reduce this subsidy, but it failed to pass in the Senate. If that had gone through, your premium hikes would have been astronomical. Beyond that, there are a few key drivers pushing costs up. And first, we have higher utilization due to an aging population. The American population in general is getting older, and older people simply use more healthcare services. And this was a point that Associate OPM Director Shane Stevens brought up in this announcement. Then you have rising provider costs. Hospitals, doctors, and other healthcare providers are facing their own inflationary pressures, and they are passing those costs onto the insurance companies, who then pass them on to you. And finally, we have the relentless march of new technology and new drugs. Those incredible new treatments and life-saving medications like the GLP-1s we just talked about are incredibly expensive, and those costs get baked into the premiums every single year. So here's where we stand. Healthcare premiums are going up again in 2026 by about 11 to 12%. And for most federal employees, that's a lot more out of pocket, easily cutting into the 1% pay raise coming in January. And you've got until December 8th to make your choices. Use that time wisely. Don't just click re-enroll and move on. Compare your options. Look at what you actually used this past year. Sometimes switching plans can save you more money than you think. And here's a word of advice I always tell my clients. Don't treat open season like an annual chore. Treat it like a financial decision, because that's exactly what it is. This trend of rising healthcare costs probably won't stop anytime soon. It's part of a bigger structural issue in the system. But staying informed and proactive can make a real big difference in what you actually pay. And this has been another piece of video, and I hope you got a lot out of it.